My journey began with a daunting challenge, traveling from Nawuni to Singa and Tamale, involving a crossing over the White Volta. Without life jackets available, I had to navigate the river just like the locals. What if resounded in my mind throughout the canoe ride. Despite the smooth waters, it was a deeply unsettling experience for me. On the other side of the river, I observed people arriving, their feet caked in mud, clearly exhausted. They warned me about the challenging road network ahead, but my determination to reach Singa held firm, and so my journey continued from there aboard a tricycle. About 10 minutes into the journey, the rugged nature of the road caused my stomach to churn uncountably. I have seen bad roads, but this particular one is unimaginable. We are currently en route from Nawuni to Singa, and the road is very terrible. It is not just bumpy, but very muddy as well. And motorcycles are struggling all the time to be able to maneuver their way through. We have quite a long journey ahead of us, and trust me, all of us on this motorcycle are already tired due to the bumpiness of the road. We've been shaking for the past 30 minutes, and we still have some few minutes to be able to get to Singa. It was a harrowing, frightening, and perilous ride. It took us about 2 hours to reach Singa, a community in the Kumbungu district of the northern region. The community's poor roads severely hinder healthcare access, leaving residents deprived. The Singa Clinic, the only health center here, is inadequate for providing healthcare to the sick. Upon arrival, I found patients already admitted at the detention room. With a shortage of equipment at the health center, nurses were forced to improvise to provide care. The facility has been leaking whenever it rains for days.
It's supposed to be our dispensary, and because of we lack so many things here, that's why we converted it here to be our where we can put our fooders and then other things here. And you can see this fridge too. We're supposed to have a proper fridge where we can even have thermometer, determine the temperature of the fridge here. And then, as you can see, we have vaccines here. And then sometimes we have to remove some of this ice pack here, put it here, and then collect all the vaccines here, just to manage the temperature.
Is the right way to preserve them?
It's not the right way, that we are just managing here.
Snake bites are a frequent occurrence here, as reported by the nurses, and vaccines to counter the venom have been depleted for months. Victims are often transferred to distant facilities, but due to Singa's inadequate roads, they frequently die while en route. Approximately 5 communities rely on the clinic, yet acquiring medication for patients proves challenging at times.
So this is where we receive our medications, most of the things that we are using currently. So we have Sapimo, paracetamol, suppository. It's not enough. It's virtually low. It's virtually small because the community is dependent on this facility. It's large. Yeah. Okay, so sometimes we have to switch to the drugstores.
The delivery room is in a dire state. The sole delivery bed is partially unstable, covered in cobwebs and dust.
Pregnant woman in labor and we cannot conduct the labor. We have to refer to the nearest, I think it's a check before Kumbungu. So when they see that the motokin, that's the tricycle, they'll put them and try their means to send the person. Sometimes they cannot reach. You have to pick the person and walk with her to the hospital. We do that a lot because sometimes when they come with complications like this, we pray before there's an ambulance, we call the ambulance to come to the riverside to wait for us. So I will join, or my colleague will join with a woman, pregnant woman. We'll be monitoring them, yes, to the riverside, then we'll enter the boat.
To my utmost shock, I discovered snakes and rats sharing the washrooms with patients. This is supposed to be a washroom for patients who visit the Singa community, and The pungent smell emanating from this side is unbearable. And looking at patients who are not really healthy, they come here to seek medical attention, and at the end will have to access such a toilet facility. It is really embarrassing. The bungalows for the health workers are riddled with massive cracks, posing a collapse risk in stormy weather. Nurses express living in constant fear. The community's assemblyman, Mohammed Swale, is urgently appealing for assistance for his people.
There are a lot of challenges, like drugs. Like this rainy season, we need drugs, and lack of the snakes injections. Sometimes we have that challenges, and workers. That one we suffer a lot, and midwives.
A local sub chief, Abdul Rahman Bawa, agrees.
The services we are expecting from the clinic, we are not getting it. The facility lacks a lot. The dosage of snake bites are lacking in the community, and we are farmers. Sometimes we lose our loved ones due to this problem.
This small community with its poor roads and inadequate clinic desperately needs help. This screen is divided to ensure that they make room here to be a dressing room. Coming with me. You come, and then there is a bench here where those who come in here to dress their wounds will have to sit comfortably. Well, when the treatment is being done, they dump the other unwanted materials in this bin. You see flies hovering all around, and when the nurses try to treat the wounds, they will be battling these flies. If you watch closely, that is just a fly here, a lifeless fly for that matter. And these are some of the materials that they use in conducting the cleaning of the sores. This is also a scissors that is being used in aiding to either cut a bandage or a plaster. That's also an ink here that helps them in cleaning the wounds of patients who visit the Singa Clinic. This is really devastating and is calling for an urgent attention. Residents feel neglected and disadvantaged, no longer counting themselves as equal citizens of Ghana. Sustainable Development Goal 3 emphasizes good health and well-being, aiming to ensure healthy lives and promote well-being for all at every stage of life. Therefore, it is crucial to prioritize urgent attention to communities like Singa. Godwin Asidiba, TV3 News, Singa, Tamale.